You know that in Switzerland, even with a private health system, your annual out of the pocket costs are capped at about 1,000 francs. Too good to be true, right? Switzerland has a hidden rule that make this possible and almost nobody outside the country knows it.
What?
Welcome back to the People's Perspective, where we unpacked what matters, decoded for people who actually think. Today, Switzerland health insurance system. It's private, it's expensive, and yet it works. Why? And what can the rest of the world learn from it? And because it's not all bad news, stay with me till the end for the happy news of the week. Two 10-year-old girls who shocked the chess world by beating grandmasters on opposite sides of the globe. Healthcare sparks frustrations everywhere. In Poland, public hospitals are overloaded and people fear privatizations. In the US, patients with insurances sometimes pay more than those who pay cash. And in Germany, people wait months just to see a therapist. Now, here's the twist. Switzerland, one of the most expensive systems, coincidentally ranks among the best for outcomes and access. Life expectancy, nearly 84 years. That's several years above the European average. So, how did the Swiss design a model that looks complicated from the outside, but residents say simply works? First thing, every resident of Switzerland must buy basic health insurance within 3 months of moving here. Doesn't matter if you are sick, old, or unemployed, the insurance has to take you. The benefits are standardized. The basic package covers the same services no matter which company you choose. So, where is the competition? Definitely not about who covers you or who offers more. It's about efficiency, service, and how well they run their networks. It's a big difference from the US, where insurances often spend billions finding ways to not to cover you. Switzerland uses two clever tools, the deductibles and the hard cap. Adults pick a deductible between 300 and 2,500 francs a year. After that, you pay just 10% of each bill. And that copayment can never go above 1,700 francs in a year. So, yes, premiums are high, but once you hit that ceiling, you are covered. No surprise bills in the mailbox, no financial ruin because of an ambulance ride. And if your income is low, the government steps in with subsidies. Imagine if that was true where you live. Share this video, maybe you can change something. Here's the nerdy part, but that's the key. Normally, insurance make money by attracting healthy people and avoiding the sick ones. To stop that, Switzerland runs a national risk sharing pool. Companies with more young, healthy clients pay into the system. Companies with more chronically ill clients get compensated. The results, insurance can't cherry pick. They have to compete on service, not on dodging risks. It's solidarity built into the rules. Basic insurance includes doctor visits, hospital stays, prescriptions, maternity care, physiotherapy, and since 2022, psychotherapy by licensed psychologists in Poland, on the other hand, families often raise money online for cancer care, which is standard in Switzerland. In Germany, therapy is technically covered, but waits can stretch 3 to 5 months. In Switzerland, people actually access the treatments they are promised. And of course, you can buy extra coverage for private hospital rooms, acupuncture, or massages, or they even pay for the fitness studio. But the essentials, they are guaranteed by the basic package. Coverage on paper is one thing, but access, that's what counts, right? So, what does this mean for us? It means healthcare doesn't have to be a binary choice between clumsy government bureaucracy and wild free market chaos. Switzerland shows a third way, a private market locked inside the rules of fairnesses. Yes, premiums are expensive. Yes, reforms are got going. But here is the truth. When someone gets sick, they get treated. No online fundraising campaigns, no bankruptcies because of the hospital bill. Just a system that actually does what it's promised. Maybe that's the real lesson. It's not about public or private, it's about rules that force fairness. And next week, we will continue our whistleblower series, episode 3, Kristen Megan, exposing environmental cover ups inside the US military. And what she reveals isn't just history, it's still happening. 10-year-old girls just pulled off something incredible. And they did it on opposite sides of the globe.
In London, Bodhana Sivanandan just then defeated a seasoned chess grandmaster. Meanwhile, in US city in Ohio, Kaya Jia did the very same, only hours apart.
Imagine that two children making history in the same day, proving that talent and courage knows no borders. It's a reminder brilliance has no age limit, and the next generation is already rewriting the rules. That's the kind of checkmate we can all celebrate. If this made you plan a national change, share it. That's how we grow. New episode every Sunday evening, Zurich time. And until then, stay informed, stay engaged, and remember, knowledge is the key.